Vaccine made in Pakistan with Chinese know-how. This factory in Islamabad aims to produce 3 million doses a month. Across the border in India, infections and deaths are spiking due to a new mutation. Pakistan's health ministry has detected at least one case of the new variant from India, known as the Delta variant. Experts warn it's likely more contagious. Will Pakistan's vaccine push be enough to stem the tide? Welcome to our COVID-19 special. I'm Monica Jones in Berlin. Thanks for joining us. Now, the good news first, the number of new infections is seemingly going down in Pakistan, though the accuracy of the data is in question. And how sustainable is this downward trend, given that neighbouring India is grappling with an aggressive variant? It may all depend on Pakistan's ability to ramp up vaccination across the country, and there's a lot of catching up to do.
It's a busy day at the Rawalpindi Vaccination Center. Every resident over the age of 19 can now register to get their jab. With vaccines bought and donated from China and allocations from the UN-backed COVAX scheme, Pakistan has now secured more than 18 million vaccine doses. And it's keen to get them out into the population. Initially, there was quite a bit of vaccination hesitancy here. But many have seen what happened in India, and they're worried. The next wave that's coming could potentially be the worst yet. When we watch videos about what's happening in India, people scrambling for oxygen and ventilators, we get scared that it could be like that here. So it's important everyone gets vaccinated. I would say that every Pakistani should get the corona vaccine. Otherwise, we'll have a similar situation as we see in our neighboring country of India. We need to avoid what's happening there.
At first, people were very scared. They were unsure about the side effects and all. But now there's awareness and people are coming to get vaccinated.
Pakistan desperately needs to increase its vaccination rate. So far, only about 2% of the population has had a shot. Infection rates have been declining over the last few weeks, but the country has only just come out of lockdown. Since Eid, there's been a loosening of restrictions. Markets and mosques are once again busy. But in some places, myths about the coronavirus persist. As a Muslim, I believe that while the coronavirus exists, it doesn't harm us inside the mosque when we come here to pray. Corona can't come inside the mosque. This is God's home, and I believe that Corona can't come inside it. But in many mosques, masks are worn and social distancing rules followed. I ask people to take care and follow what the doctors say so that we can avoid what's happening in India. Pakistan recently detected the variant responsible for the recent rapid spread of new infections in India. But even if infection rates go up again, doctors are confident that a crisis like the one in their neighboring country can be avoided.
We have arranged almost 2 to 3 times of our routine services in this hospital. We have extended our ICUs from 18 beds to 50 beds in recent days. And similarly, the number of oxygen ports, number of oxygen beds have been increased 2 to 3 folds.
Meanwhile, everyone here is hoping that these new resources won't be put to the test.
And for more, I'm joined by Hasham Akhtar. He's Associate Professor at Yusra Institute of Pharmaceutical Sciences and National Infectious Disease Specialist at Chemonics International in Pakistan. So very good to have you with us. And we hear the case numbers are going down there. Hospitals also seem to be well prepared for new cases. Does all of that mean that Pakistan has the coronavirus pandemic under control?
Well, yes, till date. The count of COVID-19 cases, it has been increasing all over the world, including Pakistan. And with every wave, like first wave, second wave, and third wave, we have learned a lot. Hospitals are well prepared. And yes, you can say that it's under control now. But if you look toward the stats, it's still on the alarming side.
Okay, explore the alarming, because certainly we hear from the World Health Organization that when it comes to the number of new cases, there seems to be a discrepancy between those that are confirmed and those that may not have been reported. How worrying is that?
Oh, well, that's a good question. I guess that in Pakistan, many patients, they go to the local clinics. Many are not counted. Many there's a huge difference between the urban and rural areas. So the count and the stats, the numbers, they are not very accurate as if you talk about Pakistan. But still, the ratio of asymptomatic patients is also high. So we assume that the suspected cases, they are much higher than which are reported.
Okay, and especially asymptomatic infections, or people with that don't show any symptoms, that obviously also keeps spreading the virus, which is dangerous. How big a role would you say do COVID mutations play in Pakistan right now?
Well, impressively, Pakistan have been reporting the full genome sequencing from the start of the pandemic, and thanks to the National Institute of Health Pakistan, which was led by Major General Dr. Amir Ikram, we reported the UK variant, we reported the Brazilian variant, we reported the South African variant, and these variants do have role in the spread of COVID in Pakistan. Last week, we had around 10 genome sequencing in Pakistan, and 7 out of 10 were South African variants. 1 out of 10 was the Indian variant. And in last 36 hours, we have around 4 more Indian variants. So it is the downfall of the third wave, but still these variants are a question here.
Okay, so vaccination is key probably to keep all of those in check, and the vaccination rate, however, is still very slow. Is the reason for that people basically refuse to get vaccinated, or are there other problems, supply perhaps?
If you talk about WHO, it says that it's around 3% that Pakistan is vaccinated till now, but the population in Pakistan is huge. It's around over 200 million people. And the vaccination rate in Pakistan now, today, is around more than 300,000 per day. So we are doing our best, and it has also been commercially available now. So we hope that in near future, we will be able to cope it now.
Right. Commercially available means it costs money to get vaccinated.
Yeah, mostly, like more than 90% is free, but still, if actually the government has divided it to between the age groups and profession-wise. So the healthcare workers and the other professionals, they were vaccinated first. But who cannot wait for the turn, he can go and purchase it.
All right, Professor Akhtar reporting here about the situation in Pakistan right now. Thank you so much for your time.
Thank you so much.
Now, one thing is certain, vaccines are key. The pandemic has forced science to react quickly and develop vaccines that can stop SARS-CoV-2. But can they do even more than that? Time for your questions now. Over to our science correspondent, Derek Williams.
Do COVID-19 vaccines also offer some protection from other types of coronaviruses?
The pandemic has turbocharged research into coronaviruses. We've learned a huge amount about them in the last 15 frantic months, including in an area called cross-reactivity, which involves how the immune system can react to similar structures on the surfaces of different types of viruses. In other words, how your body might not have to learn everything from scratch about a pathogen if that pathogen reminds it of a bug it encountered in the past, say because it has similar spike proteins. All coronaviruses have spikes. Theoretically, at least, That means that teaching your immune system to recognize SARS-CoV-2 spike proteins could maybe also help it recognize and prevent infection with other coronaviruses, if the spikes are similar enough. Among others, a study published last month by researchers at Johns Hopkins University in the US shows that the idea isn't far-fetched. The researchers looked at the response of what are called T cells, which play an important defensive role in immune system response. And the study reported that after people were given a vaccine against COVID-19, their T cells also responded powerfully to a related coronavirus that causes colds. The assumption is that cross-reactivity was providing some protection. There's still much to learn, but a lot of experts think the work being done in the fight against SARS-CoV-2 will lead to a real revolution in how we address future coronavirus threats. Some even believe we're not far from developing one-shot vaccines that will work against a wide range of coronaviruses. Lots of attempts to make one are already in animal testing.
Now, who says bank holidays are a waste of time? In the United Kingdom, anyone over 18 could get a shot on Monday. Waiting in the sun, thousands spent this bank holiday to get vaccinated against COVID-19. Well, not much distance keeping, but a new trend perhaps. That's all for this edition of our COVID-19 special. Thanks for watching. Stay safe.